So here's what's going to happen now. It's, about 10 after 12 Mountain Time. I know you're probably hungry. That's allowed. That's okay. So what we're going to do is Andrea Grabovac, who's our next speaker, has graciously said that if people want to take a minute, grab some lunch and eat it, in the first part of her time with us, that's totally fine. We all need that, physical nourishment as well as the nourishment we're getting intellectually and spiritually in a way. But then she will take us through other pieces of this, including a more formalized, talk in about 45 minutes or so. Let me give a quick introduction. I'll tell you a little bit more about Andrea later, but she is the co-director of the North American chapter of Mindfulness Integrated Cognitive Behavioral Therapy Institute at the University of British Columbia in the Department of Psychiatry. She's got an extensive bio, including many years of outpatient psycho-oncology experience. And the other thing that's interesting about Andrea is she's obviously also a yoga teacher and has been trained and practiced in Burmese Theravada Vipassana. I hope I said that right. That's the tradition, and she's been involved in that since 2002. My sense is there'll be some element of her practice in that regard in what she takes us through. So a little bit more about Andrea a little later, but I will turn things over to her. Grab your lunch, settle yourself, and Andrea will take us through the next little bit. Welcome, Andrea.
Thank you, Ken. Thank you for that kind introduction. Can you see me and hear me clearly?
Crystal clear, and you look great. Welcome.
Thank you. And welcome everyone to this lunch hour guided meditation practice session. It's really a pleasure to be here with you. And I'm grateful to TIES and Alberta Mind Biotech and Alberta Health for this opportunity. For our first 10 to 15 minutes together, I'll be introducing the mindfulness skills that we'll be practicing in the second half of our time together. So now is a good opportunity to enjoy some relaxed bites of lunch as we contemplate and reflect on aspects of mindfulness before we go into more of an embodied practice. So I'll take a moment to share my slides. Here we go. So one of the questions that comes up frequently when people are learning mindfulness skills, and we're really learning all the time, is how to be mindful during the really challenging moments in daily life, when conditions are not perfect, when we're not at our best, which is when we're most likely to react in habitual ways. So building on some of the skills that Tom introduced us to in his talk before lunch of allowing and acceptance, in our time together now, I'd like to introduce us to a 30-second mindfulness tool that's very portable. So once we learn it, we can use it anywhere, anytime. In the grocery store lineup that's moving ever so slowly when we're in a rush, or while waiting in the doctor's office when we're feeling worried about a loved one or about our own health. So this 30-second mini practice is called the mindfulness-based interoceptive exposure task, and it has 3 steps. We'll be practicing it together today at the end of our formal practice time. In this 30-second practice, we train important skills of approaching rather than avoiding our internal experience, of literally focusing on feeling the sensations inside of our bodies and even practicing welcoming the sensations that we're feeling rather than resenting them or resisting them, which is so easy to do with difficult, challenging sensations. In my presentation after lunch, I'll be reviewing the changes in the brain that happen with regular practice of these mindfulness skills and the many positive results of this, including better mental and physical health. So before we go over the 3 steps, I invite you, if you feel comfortable doing so, and if it feels safe to do so now, to imagine this following scenario. And if this particular scenario doesn't work for you, imagine a different challenging interaction with a coworker or another family member as we go through this example. So here's the situation. You need to drop your child off at school early today because you know you have an important work meeting to get to. You should have already left, and you know traffic will be heavy. And because the routine's a bit different than usual, your child is having some trouble getting ready. So as you imagine this, maybe even visualizing it so vividly that it feels like it's happening to you right now. Maybe you can even feel some of the sensations in your body that you would be feeling if this was happening in real life. Your child starts to cry and he's refusing to put on his shoes. And as you're standing at the front door, you feel your phone buzz, reminding you about the meeting. And what happens next? Probably the I, me, and mine thoughts follow. Thoughts like, oh, I should have left more time. I'm always late. I can't get my act together. Or I knew I should have woken him up earlier. And you can insert your most commonly arising negative habits of mind here. And here's the key: whether we're aware of it at the time or not, these kinds of I, me, or mine, these self referential thoughts, are always accompanied by co arising sensations in the body. Perhaps in this scenario, a tightness and heat in the chest or a heaviness in the gut. And these are the sensations that add up over time that we recognize as stress in our bodies. And our habitual reaction might be, in this example, to snap at our child, saying, hurry up, we're going to be late, hoping that they'll spring into action to get out the door and the tightness in our chest, this stressful feeling, can ease. If you think of your own experience, does this kind of loop of reactivity, does it sound familiar? When we find ourselves in a tight spot like this, we often respond habitually in ways that are not helpful in the long run. Commonly, we might react to try to avoid the unpleasant sensations, for example, by avoiding specific situations. Examples might be avoiding social events or avoiding specific difficult conversations. Or we might ruminate, working the problem over in our mind over and over again. Sometimes that process feels out of our control, trying to solve and control the situation in our minds. Or maybe we suppress our feelings altogether. So these unhelpful strategies, they kind of make sense in the moment because often the unpleasant sensations decrease, but they end up leading to increased anxiety and lower mood in the long run, and are associated with higher levels of anxiety disorders, depression, eating disorders, and other mental health conditions. So when we're caught in a loop like this, with our reaction leading to more stress feelings in the body, which can lead to more critical and worried thoughts, leading to more harsh words, this is when it feels hardest to regulate our emotions, and it's when we need our mindfulness skills the most. So, how do we most effectively apply mindfulness, especially that equanimity component, on a morning like this, in a situation like this? And I'm noticing that somebody's pointing out in the chat that this is the scenario in her life or his life every morning with their little one. And there are probably others who also really relate uh, to these situations that we find ourselves in, where maybe even as this is unfolding, our heart is aching because we're wondering, there must be another way. So what part of this sequence, of this loop of information processing, can we most effectively bring mindfulness to? Is it to the reaction we're having? Is it to our thoughts that have popped up? Some of you might be thinking that it's to the situation itself. And that's understandable because there's a common misperception, sort of in the popular media, really, that mindfulness is a accepting and non-judgmental attitude to what's happening, to the situation that we find ourselves in. That's a common misunderstanding. However, just like this beautiful shoreline that's drowning in garbage, there are many situations in our lives and in the communities we live in where it's not appropriate to be accepting and non-judgmental of the situation. Tom referred to this at the end of his talk. With mindfulness, we are not trying to condone or somehow make ourselves accept a situation that's unjust or wrong. This shoreline calls for action. inform mindfully, not a non-judgmental acceptance. So instead, one of the most effective ways we can work with mindfulness is to use mindfulness to skillfully approach these often unpleasant and challenging sensations in our bodies, whether it's sensations that arise in the context of having a hard time getting out the door in the morning with our child, or the shoreline littered with garbage, or so many of which have already been touched on in this conference today. So I mentioned that I'd be sharing a 30-second practice for training mindfulness skills in this context. So I'd like to share these 3 steps of this 30-second practice with you. The first is to become aware of the sensations. Think back to when we were visualizing that example. Were you feeling any unpleasant sensations in your body? With this method, we first become aware of the area of most intense sensations you're feeling right as the situation is unfolding, such as perhaps for this parent, tightness in the chest. Next, we observe these sensations with equanimity, with bringing an equal, genuine interest to each sensation, whether it happens to be pleasant, unpleasant, or neutral, and bringing this real welcoming, this heartfelt willingness to feel the sensations in our bodies. Remember, we're not accepting or condoning the littered shoreline. We're just bringing this welcoming to our very own experience in the moment. And here's a very specific way of doing that. Just like all the amazing flavors of international cuisines are made up of 5 basic tastes: sweet, sour, bitter, salty, and savory. So too, all of the different sensations that we feel in our bodies are made up of only 4 basic building blocks of sensation. These are mass, how light or heavy the sensation or area of most intensity feels; temperature, how cold or cool or warm or hot does it feel; movement, is it quite still or moving very fast; and tightness, from loose and expansive to tight and constricted. In step 2, paying attention to the area of intense sensation in terms of these 4 building blocks of sensations allows us to be really objective towards them. We can call them heat instead of anger, constriction instead of anxiety, heaviness instead of sadness or guilt. And this helps us to not personalize the sensations we're feeling, to not identify with them, to not perpetuate the stories we have about them, that I should have, would have, could have, what if. And then for just the 30 seconds, we welcome these sensations without reacting to them, not resenting them, not resisting them. And after we do this for 30 seconds, we might notice that it doesn't feel as urgent to make the sensations go away by reacting to them. And this gives us the space to respond more skillfully. In this example, we now have the capacity to perhaps acknowledge our child's experience instead of snapping at them, and the scenario can unfold very differently. So as I'd mentioned previously, these 3 steps are called the mindfulness-based interoceptive exposure task, or MIET. The acronym is on the slide here. And they're part of a 9-week mental health treatment called Mindfulness Integrated Cognitive Behavioral Therapy, or MICBT. I'll be mentioning this 9-week treatment, talking a little bit more about it after lunch. So we can use this 30-second practice, these 3 steps, during the day, whenever we're experiencing physical or emotional stress. And we can use them to develop and train equanimity, receptivity, welcoming our own experience in the moment without condoning or necessarily agreeing with the situation around us. And be present for ourselves, support ourselves in the moment, and then be able to act with more discernment, more mindfully. So we'll talk a little bit more after lunch about how to work with the Miet in seemingly small moments in the day that we might not even usually notice, perhaps even when checking email, to help train mindfulness and equanimity. So the trick with these 3 steps, like with training any new skill, is to practice, practice, practice until it becomes second nature. So now we have the opportunity to practice. And hopefully you've had a chance to have a few bites of lunch. And as we begin this guided mindfulness of breath practice, and then going into the 3 steps of the Miet, you can transition to having a last bite or two, putting down what you've been holding, and settling into time for more practice. We're all getting a real workout today. It was so wonderful to have these opportunities for practice in each session. And mindfulness of breath practice, uh, we can experience it as being frustrating. And it can also be really fun because, on the one hand, we think that we're bringing attention to our breath, right? But what happens? Where does our attention end up going, right? It so often ends up going to thoughts or anything but the breath. So even though we call it mindfulness of breath practice, as we go through this practice period, I'd love for you to keep in mind that it's really an opportunity to observe the functioning of the mind. So although ostensibly we'll be focusing on the breath, anytime that attention goes to thinking, that's wonderful. And there's a lot to notice there about that process. And I'll be guiding us through that. Also, before we get started, I want to mention that when we're practicing the 3-step Miet process together at the end of our guided practice today, instead of working with an example using emotional intensity, like the one I shared with you of the difficult morning routine, parent and child, and you may have been working with a different example yourself. In those examples, the origin of the intense, unpleasant sensations in the body was an emotional experience. For this practice, we'll be working with physical intensity in the form of physical discomfort or pain that's arising in the moment in the meditation practice. That's also a very valid way of working with the 30-second Miet practice. And if you don't have any intense pain or discomfort arising in the moment, you can choose to, if you like, create some intense sensations in the body by, for example, lifting an arm for several minutes. And again, I'll be guiding you through that. So let's start by coming to a posture that supports an alert observation of your moment to moment experience, whatever that is for you at this time. Again, putting down anything that you might be holding in your hands. And if you're wearing glasses, perhaps you can take those off as well. Closing your eyes if it feels comfortable and safe to do so, or lowering your gaze a few feet ahead of you and keeping the gaze soft and unfocused to minimize visual distraction. And noticing your posture, the position of your body, perhaps noticing the sensations of your feet on the floor or in your shoes, the backs of your legs if you're sitting in a chair, noticing where they meet the chair, and your hands in your lap or resting on your thighs, and noticing the arms and shoulders and the head balanced on the spine. And gently making any adjustment in your posture to be comfortable and at ease, while also allowing for the possibility of some discomfort arising during practice and being okay with that. And perhaps consciously releasing any excess tension in the body that's not needed in this moment for this practice. And now gathering attention and allowing attention to rest on the sensations of breathing at the nose. The invitation is to focus on the area of the entrance to the nostrils, including the area of the upper lip. And of course, you can always, for yourself, choose a different location in the body to focus on, if that is more suitable for you today. So, noticing sensations associated with the movement of air coming in, going out, perhaps sensations of temperature, coolness on the in breath, warmth on the out breath, or perhaps sensations of movement of the air, touch, tingling. Noticing whatever sensations are arising in the area of the upper lip and nose. And allowing the breath to be as it is naturally in this moment, whether that happens to be faster or slower, more shallow or deep, not controlling the breath in any way. There is no correct way to breathe for this practice. Instead, observing the breath in its natural habitat, so to speak, without disturbing it in any way, as it arises and passes moment to moment. Welcoming this breath as it is in this moment. And whether it's experienced as pleasant or unpleasant or neutral, perhaps welcoming each sensation with an equal interest, a genuine curiosity. And allowing the breath of the nostrils to be the primary focus of attention forms a beautiful backdrop on which to observe the natural activity of the mind. By becoming more familiar with the habits of the mind during our mindfulness meditation practice, we can then work with habits of worrying or other unhelpful thinking patterns during the rest of the day more skillfully. One of the first steps to becoming aware of the habits of the mind is to notice when we have started thinking. So, as you continue to bring attention to the sensations of breath, you might notice that attention has spontaneously moved to a thought or image or another mental event. Noticing this thought as a mental sensation. For the purposes of this practice, learning to see thoughts for what they are, simply mental events. And then not engaging with the content of the thought, not getting caught up in it, or identifying with it, or reacting to it. Perhaps saying, thanks, but no thanks, not at this time, to the thought. And finally, releasing attention from the thought and shifting attention back to the breath of the nostrils. And we can release attention within 2 seconds. Because if we stay with the thought for more than 1 or 2 seconds, we're much more likely to become caught up in thinking the thought and forgetting our intention to be meditating, to be observing thoughts as mental events in the mind rather than actively thinking them. continuing to rest attention on sensations of breath with curiosity in this moment, with this breath. And each time you notice that you've become lost in the content of thoughts, perhaps carried away by thinking, and forgetting to pay attention to breath sensations, forgetting the intention to be meditating, no problem. Bringing a receptivity even to this experience, welcoming even this, and congratulating yourself on recognizing that you'd forgotten the intention to meditate and have become caught up in the content of thoughts, and then bringing attention back to noticing breath sensations at the nostrils. Without any reactivity, releasing attention from the thought and bringing attention back. And over the next several breaths, we'll transition to the 3-step Miet practice. As I mentioned in the example of the parent and child, the origin of the intense, unpleasant sensations in the body was an emotional experience. And for this 4 or 5 minute version of the guided Miet practice, the invitation is to use sensations of physical discomfort that might be present in the body right now. Sensations associated with sitting, or an ache in the lower back, or maybe some discomfort in the neck or head. Hopefully, most of you can identify an area of the body where uncomfortable, unpleasant sensations are arising. And if not, you can, for example, raise an arm to create some sensations of more intensity. So, beginning with step 1 by scanning through your body to locate the area where you're experiencing the most intense sensations. Now focus all of your attention at the center of the most intense sensation, the area that you might call discomfort or pain. And focusing on this area in terms of those 4 basic characteristics. Focusing on mass, is it heavy or light? Movement, does it move a bit or is it still? Temperature, is it cool or warm? And tightness, is it tight, constricted, or loose, expansive? Remaining very aware of this area of sensation that's the most intense with these 4 characteristics without making any judgment, without resenting, without moving the body in order to stop the sensation. Trying not to identify with the sensation and instead perceiving it as a physical event that's impermanent, knowing that sensations always change. So starting now, I'll time you for 30 seconds and with no judgment, no reactivity, observing with curiosity, a little bit like a scientist recording observations and collecting data, noticing, is it heavy or light, still or moving, cool or warm, constricted or loose? And keeping your eyes closed, describe to yourself in silence what you now feel in this part of the body, whether it is heavy or light, cool or warm, moving or still, tight, dense, or loose, diffuse. And once you've gone through these 4 characteristics, rate how much distress you feel now or how intense the sensations are now out of 10. And compare it to how much distress or how you were feeling or how intense they were out of 10 2 minutes ago, just as we were starting this practice, and see if it has changed to some extent. And whether it's changed or not, try not to judge this one way or the other. You're just collecting your own data. And now returning to the same 30-second task, but this time we will add that very important aspect of mindfulness, that acceptance and indeed welcoming towards the sensations. So bringing attention back to that same area of the body where sensations were the most intense at the beginning, and continuing to observe those 4 basic building blocks of sensation, the mass, motion, temperature, and solidity, without any reaction. And this time, welcoming these sensations, welcoming them, not taking them personally. See them for what they are. In fact, help them to feel at home, so to speak. So try it now for 30 seconds. I'll time us. And if some thoughts arise, let them pass without engaging with them. Quickly release attention from them and return attention again to the area of sensations. Continuing to observe and welcome with unconditional acceptance. Heavy or light, still or moving, cool or warm, constricted or loose. And keeping your eyes closed. Describing this one last time to yourself to what extent you feel mass. Is it heavy or light? Or movement? Is it moving or still? Temperature? Is it warm or cool? And tightness? Is it tight or loose? Just observing these 4 characteristics, and now rate again how much distress there is, how distressing it is, or how intense the sensations are out of 10. And on your own time, opening the eyes and taking a moment to reflect on your experience. Perhaps jotting down anything that you noticed about the breath that caught your attention, or about anything you noticed about patterns of thinking. And if you like, you can also put in the Huva chat what your first score was on the Miette out of 10 at the beginning, before any of the steps, and what your very last score was that we just did now, the 3rd rating, after welcoming the sensations with full equanimity. And I'm curious as to what you experienced. Once you're familiar with the steps of this practice, you can use the 30-second version where it's combined, the no reactivity and full welcoming. And you can use it eyes open, going about your usual activities, during conversations, in that grocery store lineup. Hopefully some of you had the opportunity to experience bringing an equal interest to the sensations, whether they were pleasant, unpleasant, or neutral, without using the sensations to feed a personal narrative or to create more self-referential thoughts. And we use this practice a lot clinically with clients, patients, group participants. And when participants are first learning this practice in session, sometimes the level of intensity doesn't go down right away. And this is usually because at some level, and this is very natural, and we all do this when we begin learning, they're still identifying with the sensations. Some of those I, me, and mine thoughts are still happening. So we go over their technique and refine it and repeat it until they experience that decrease in intensity. I hope that this practice and the mindfulness of breath and this introduction of the 30-second mindfulness-based interoceptive exposure task has been of some benefit. And thank you for joining me for this lunch hour meditation. We've had the opportunity to practice this together, and it's a great tool for training equanimity to sensations, and through this, decreasing our reactivity and associated habitual behaviors. I look forward to seeing some of you for the afternoon session, where we'll talk more about the Miette and this loop of reactivity. Thank you.
And thank you, Andrea. What a wonderful experience and practice. The thing that I was thinking about was how much curiosity plays a role in this framing, in these practices, about the sensations we're feeling, about how we interpret them, and then that second part, which is the welcoming. They work so well together. If you don't mind, I've got a couple of questions. We've got a little bit more time before the afternoon session. We will be talking a little bit with healthcare workers and others in the afternoon session, but I am curious, how much do you see, or in your colleagues, your medical doctor as well, in your own colleagues, a wanting, a needing for these kind of tools in medical practitioners? I can just imagine what the last 16, 17 months have been like for many people in the medical field. And I know we'll drill into that, but for the sake of the audience here in the morning, just wondering how important are these tools to your colleagues and yourself?
These tools are very important for all healthcare providers and all people in roles of caring, right? Caregivers to children at home, caregivers to elderly parents, or to loved ones or friends who are struggling in some way. When we care, when we're conscientious, compassionate, and often it's those of us who have a natural inclination, who have more of those traits naturally that go into healthcare, right? Or are the ones who are looking after and caring for family members. That genuine wanting to give, wanting to help can really set us up for putting ourselves on the back burner, for becoming the last person that we tend to. And it's often a real learning journey that can be quite challenging to recognize that we can only be really of help to others in as much as we are doing well ourselves. So we have to take care of our own tank. We can't give to others from a empty bucket. We have to fill our own bucket as well.
Yeah, that's so well said. And I'm glad you broadened it past just professional healthcare workers. Just because you don't have the scrubs on doesn't mean you're not providing support to a family member or your own children or elderly people in your life, or even just the community in approaching kindness. This is wonderful. It's about 10 minutes to the top of the hour. We're going to be back with you at the top of the hour and learn a bit more, particularly on that burnout factor that you've started to talk about. But I know that we want to ramp people up for a busy afternoon. So why don't we come back in about 10 minutes? People can take a break, go refill whatever bucket they need to refill right now. And then we'll be back with everybody at 1 o'clock Mountain Time in just about 8 or 9 minutes from now. So we'll see you in just a few minutes.
Thanks so much.
Thanks, Andrea.